Good morning and welcome to Face the Nation. More than 151 million American adults are fully vaccinated. That's just under 60%. But just under a third of American adults have not had even a single shot, which is worrisome to health officials. The Delta variant now makes up more than half of all new cases in the U.S. In addition, there's new confusion over the role of a booster shot. We begin today with Dr. Anthony Fauci. Good morning, Dr. Fauci.
Good morning, John.
Let's start with the Delta variant. It seems to be making the case for vaccination more clear than ever, with those who are being seriously affected coming from the population of those who are unvaccinated. That would seem to make a clear case. Is it that the facts are not getting to people, or is it the people delivering the message to those who are unvaccinated that needs to change?
Well, I think maybe all of the above. It is almost inexplicable why people, when they see the data in front of them, that they don't get vaccinated. We have a Delta variant that you mentioned, John, that is easily transmissible, much more easily and readily and efficiently from person to person than the other viruses, the other variants that we've dealt with. That's the first thing. The second thing, the data that's hitting you right between the eyes, is that 99.5% of all the deaths to COVID-19 are in unvaccinated people. So you're talking about something that's life-saving. So the idea of why some people, for whatever reasons, and we know some of them are ideological, we know when you look geographically in the situations where you have under-vaccinated states, where you have 30% or less of the people vaccinated, I mean, we've really got to get beyond that, and we've got to put those kinds of differences aside and say this is a public health issue. When you hear people at rallies talking, don't get vaccinated, don't get vaccinated, John, it doesn't make any sense, because we're talking about a public health issue that is life-saving for you, your family, as well as your community. So you're right, we are in a very difficult position. We have more vaccines in this country than we know what to do with. Everybody and anybody can get vaccinated, and we have people throughout the world who would do anything to get vaccinated because they appreciate the importance of safeguarding their health. So it's a very, very frustrating situation.
I want to get to the science of the Delta variant in a minute, but let's stay on this question for a moment and ask you about human psychology. You say the facts are hitting people between the eyes. Is it possible that people are a little scared, a little nervous, and the more facts they hear, they don't hear evidence. What they hear is, you're a dummy for not getting this. And that essentially people feel insulted when the evidence is presented as if it should be clearly obvious to any normal person, and that all that does is put them back in their corner.
You know, you have a point there, and that's the reason, John, where what's going on right now is getting trusted messages, not government officials like myself, but trusted messengers in the community to outreach to people. And those messages could be your family doctor, it could be a clergy person, it could be a community leader, it could be a sports figure, it could be the people who are really trusted by the community. So you're absolutely right. I mean, telling people, you know, you've got to get vaccinated, you've got to get vaccinated. I mean, I think it's important to point that out. People do need to know, not in a pejorative way, not in a finger-pointing way, but just look at the data. 99.5% of all of the deaths are among unvaccinated people. So we have vaccines that are highly, highly effective. And what we need to do is to get those trusted messages, which we're trying to do, to get out into the community and explain to people, you know, in a non-finger-pointing way, why it's important to get vaccinated.
Let me ask you about, let's take two different states, because the Delta variant operates differently depending on the vaccine rates in different states. So describe for me, let's take two states. Massachusetts has a high vaccination rate. Mississippi has a low one. If the Delta variant it's the majority variant in the country, it's only going to get worse. Tell me how people who live in those two states should think about the Delta variant, given the levels of vaccination in those two places.
Okay, John, that's a great question, and it's a pretty simple answer. The vaccines that we have available, the people, for example, as you mentioned, in Massachusetts and other states who have a high degree of vaccination, quite protected against the Delta variant. All the data that we have from this country and from several other countries, not just the United States, show that the vaccines that we are using right now do very well in protecting against the Delta variant, particularly protecting you against severe disease that might lead to hospitalization. For those states that have a very, very low level of vaccination, you're dealing with a virus, the Delta variant, that's highly efficient in spreading from person to person. And the numbers don't lie. In those states where you have a low degree of vaccination, that's where we're seeing surges of infection, which are followed by surges in hospitalization, which will ultimately lead to increases in deaths. So it's pretty clear from the data, John, that if you are vaccinated, your risk is extraordinarily low. If you are unvaccinated, you have a high risk of this very nasty variant, the Delta variant.
Let me switch to the question of boosters. Pfizer this week said that there was evidence that immunity diminishes from the vaccine, and they've called for a booster shot. The CDC and the FDA said in a joint statement, Americans who have been fully vaccinated do not need a booster shot at this time. Any statement that says at this time can, of course, change tomorrow. So what exactly is the situation with boosters and the future possibility of needing one?
Well, certainly it is entirely conceivable, maybe likely, that at some time we will need a boost. It may be differentially needed depending upon the age of individuals and their underlying conditions. For example, people who have underlying conditions that make them more likely to have a severe outcome. The situation, and you're right, John, it could be confusing. When you're talking about an official recommendation from a public health organization like the CDC or a regulatory agency like the FDA, it will have to be based on solid data from both laboratory and clinical studies. And in real time, those agencies follow and do studies. We at the NIH are doing a number of studies to determine, do we have solid evidence for doing this? Now, right now, what the CDC and the FDA said in a joint statement is that at this time, we don't see the need for it. What the pharmaceutical company Pfizer did, they did their own study and said, you know, we think you're going to need a booster, so we're preparing to boost. That's fine. We want companies, we want academic institutions, and we want the government to continue to collect data. So it really is a question of a firm recommendation versus an opinion.
Let me ask about that timing question, though. Some people in nursing homes, for example, vulnerable populations, got their shots many months ago. The clock is ticking. So is it going to be possible to begin the process of preparing for a boost so that when it's needed, if officials decide it's needed, companies and the process will be in place to give it at the right time? Or will the machinery have to get going to get a boost and it'll be, the window will have closed essentially to give it to people?
Great question, John. No, the process is going on right now. We at the NIH are doing a number of studies looking at the feasibility of boosting, the kinds of boosts you might want to get, what kind of timetable for the boost. Those studies are going on right now. So it is really a very good question. It isn't as if we're going to start from square one if it looks like there are breakthroughs in infection or if it looks like the laboratory data indicate that there's a diminution in immunity. By no means. Right now, we are preparing full throttle for doing boosters if we need them.
All right, Dr. Anthony Fauci, thank you so much for being with us.